Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center reporting for the week of April 12th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 84,000 COVID cases and 1,446 COVID deaths. Hospitalizations continue to come down, as do overall case rates. Case positivity rates are also coming down on average across the county, and about 1.2% of tests over the past 28 days on average have been positive. But as has been the case throughout the pandemic, East Oakland continues to suffer disproportionately with zip codes 94601, 94603, and 94621, with positivity rates that are triple or more the county average. And those range from 3.2% to 4.3%. So the case rates remain the highest within those East Oakland zip codes. Vaccination rates continue to increase across the county, and we are now at about 33% of those 16 and up being fully vaccinated. And that is true for the county of Alameda as well as for the city of Oakland. And roughly that equates to about 26% of the population being fully vaccinated when we take into account the fact that there are about 20% of our population that are under 16 years old. So a little over a quarter of the population is fully vaccinated. So we are certainly improving, but definitely nowhere near herd immunity or population immunity. We are pleased to share today that Alameda County Department of Public Health is now displaying vaccination rates by zip code on the county dashboard. And so when you take a closer look at Alameda County, you can see that those same zip codes that I just showed with the highest positivity rates are also the zip codes with some of the lowest vaccination rates. You can see that 94621 and 94603 have some of the lowest vaccination rates with that lightest blue color. And they are at about 19% of those 16 and up being fully vaccinated, which roughly equates to 15% of the population in those zip codes being fully vaccinated. The county has accordingly implemented new eligibility criteria for vaccination. And if you live in any of these zip codes, you are eligible for vaccination, regardless of any other factors like your occupation or any conditions you may have. And those are 94601, 94603, 94605, 94606, 94607, and 94621. Those are in the East Oakland zip codes. And you can see as well the Hayward zip codes of 94541, 544, 545, 577, 578, and 580. So once again, all of these zip codes, if you live in these zip codes, then you are eligible for the vaccine if you are 18 and up, regardless of any other eligibility criteria. Now, today I want to talk a little bit about the new CDC guidance that most of us have probably heard about by now, that says that surface cleaning is no longer so important and that we can pay less attention to disinfection than we had thought in the past. And so I wanted to get a little bit into this because this is creating some level of confusion, and I wanted to help sort that out. So we know that the three ways that we get COVID, and I think we're all in agreement, although you may recall that there was a lot of controversy early on around the ways in which COVID is transmitted, but I think we are all in agreement now that there are three primary ways, and those are droplet, airborne, and contact. So, droplet transmission is when someone who has COVID exhales it, maybe they cough or they sneeze it out, and those droplets contain the COVID particles, and then you breathe them in, and that is droplet transmission. And that is the most common way that COVID is spread. We also have airborne transmission, which refers to smaller particles. They also contain the virus, but these are thought to be transmitted at longer distances and over a longer period of time. So, this is when we get worried about indoor spaces and closed spaces where we are together, and eventually the room does fill up with those particles, and that is more of aerosol or airborne transmission. And so, this is where we get concerned about areas without proper ventilation and being in indoor crowded spaces. And then lastly, and the one I'm going to talk about a little more today, contact transmission, which is when you touch a person who has COVID, perhaps through handshake, for example, or you touch a surface that has the viral particles, and then you touch one of your mucosal surfaces like your mouth or your nose or your eyes. And so this is why we talk about washing hands and not touching your face. So droplet, airborne, contact, probably in that order, are the ways in which we can contract COVID-19. So we know that the most important intervention for droplet transmission is mask and distance. And that is because the mask will actually keep the infected person from expelling those droplets, and it will also prevent you from receiving them from that person. And the distancing is because, for the most part, we think that those droplets don't travel much more than 6 feet. And so for droplet transmission, we actually think it probably doesn't matter necessarily just how transmissible the virus is, because the droplets travel just as far. And so, as it relates to droplet transmission, whatever strain we're talking about, the masking and distancing guidelines are roughly the same. It's when we get to the airborne transmission that we do start to get more worried about those more transmissible strains, and where we start to talk about stepping it up in terms of our masking and maybe even in terms of our distancing. But even more importantly, most importantly, as it relates to airborne transmission, that we are either outdoors or we are in indoor spaces that have appropriate ventilation, and that there is good air exchange and filtration. And then lastly is our contact transmission. And this is where we talk about the interventions being hand washing, disinfection, and sanitization. So we were told initially in the pandemic that the most important thing was to hand wash and also to not touch our faces. And this is because we thought that contact transmission played a much larger role in transmission than what we are thinking now. However, there is really no disputing the fact that we can transmit COVID by contact. And so, again, either through touching another person or through surfaces, or otherwise what we call fomites, which are basically just inanimate objects that can have the viral particles on them. And by then touching them or touching our face, then we can get infected. And so, what is the deal about why now we're saying, or why the CDC is saying that we shouldn't be as worried about this? Well, I really can't read their minds or actually understand why this would be a recommendation at this time, given the fact that we have over 100 million documented cases of COVID-19, probably many, many more that we have not detected. We have hundreds of thousands of people who've lost their lives to COVID just here in the United States alone. And some percent, maybe it's a small percent, have contracted it through fomites or through surface transmission. So I think that it is logical to think that it is appropriate to keep surfaces clean and to continue to wash our hands. So, not really sure why the CDC felt this was important guidance. I think that they want to make sure that we are focusing on the most important thing. But I believe we can walk and chew gum at the same time, so to speak, and we can worry about all three forms of transmission and do our best to intervene on any of them. So, how long does COVID last? Well, there have been a number of different types of studies that try to get at this. It's actually not that easy to determine whether this is, in fact, how the virus is being transmitted, but there have been some pretty good studies that show that the virus will last for 5, even up to 7 days on some of our harder surfaces like glass, plastic, or stainless steel. But on woven surfaces, on fabric, on paper, it lasts much less time. So more like 24 hours. And there was a pretty interesting study published in Physics of Fluids that actually went into great detail about why coronavirus survives longer on the impermeable surfaces like the glass or stainless steel or plastic than they do on the porous surfaces like paper or fabric. And it has a lot to do with the fact that these droplets land and they sort of form this pancake. After the some of the fluid evaporates, you get like this little layer of a droplet. And that is where this virus, it turns out, can last a number of days. But on these woven surfaces, there just is not as much flat surface area for this droplet or pancake droplet to actually stay. So there's just much less surface area, and you have less length of time that it can last on that surface. So if you've got a cardboard box or an envelope, then it's only going to last maybe 24 hours. And that is assuming it's not out in the bright sunlight, because we know that it goes away even faster if it's out in UV light. Also, if it has a tape or it's laminated, then it will last much longer, like closer to that 5 to 7 days, because of that impermeable surface. And so we know that the virus can last there, but for you to get infected with it, you then have to touch it, and then you have to touch your eyes or your nose or your mouth, which we know that people tend to do. And so if you are passing things from one person to another, if you have things delivered to your home, then those potentially could have viral particles on them. And I really don't see any harm in just wiping them off. And so I think the point might be that we don't want to get too ridiculous or too obsessed over it. We may all know someone who goes a little overboard when it comes to these kind of guidelines and washes their hands to the point that they're dry and cracking, or puts hand sanitizer on so much that you're wondering if they could be causing themselves harm. I think that is really the minority of folks. And for the most part, if we are in a routine and we've been disinfecting and sanitizing surfaces, and we are not doing that to the point where we're ignoring the other things we need to do, then I think it is perfectly reasonable to continue doing these things and don't feel that there's any pressing reason why we would need to stop. Because even though, again, it is less common to transmit it this way, it is still possible. And I think we can do all things at the same time. And there's a couple of main reasons why I'm really emphasizing this today. The first reason is because we are at a point where we are starting to open up businesses and do more gathering indoors, because more venues are open and there's more opportunities for mixing. And so this would seem to me to be not the appropriate time to actually do less in terms of COVID mitigation strategies. This may actually be the time to do more, because you have more time inside mixing. And we know that with both droplet transmission as well as aerosol, that those particles eventually do land somewhere or adhere somewhere. And so it is perfectly reasonable to continue wanting to wipe off those surfaces. Now, obviously, we want to make sure that the disinfection chemicals that we are using are not harmful, or that we are not spraying them out into the air where other people are around and could then inhale it. But I think that most of the businesses have gotten the good guidance about doing this, for example, at the end of a day or at the end of a shift. When a patient leaves a room or when children leave the classroom, for example. And so it makes perfect sense to continue wiping down surfaces. And so that would be more the sanitization, which is removing the particles. And when the areas are vacated, going ahead and disinfecting using some type of chemical to actually kill the viral particles. So we think this is still important. So, again, the first reason why we think it is not a good time to do less is because we are starting to open more venues and places of business where there's more mixing. And so we think it is a good time to just keep up the practices that we have developed around disinfection and sanitization. Now, the second thing is that the CDC has said, and I'm reading now from the CDC guidance, in situations when there has been a suspected or confirmed case of COVID 19 indoors within the last 24 hours, the presence of infectious virus on surfaces is more likely, and therefore high touch surfaces should be disinfected. Now, we all know by now that we don't know when there is a suspected case of COVID. And furthermore, we all know that the most infectious time is before the person gets symptoms. So, in that first 5 days or so after a person catches COVID, there is the highest replication of the virus within that person, and they're thought to be the most infectious during that time. This is before they get symptoms, and it's before their test turns out positive. So it's hard to follow a logic of saying that we should only be disinfecting when someone with suspected COVID was present in the last 24 hours, because as far as I'm concerned, that could be anyone, particularly anyone who's unvaccinated. And again, in those situations, we do not know who is who. So it doesn't seem to make too much sense to wait until you have a confirmed case or wait until after you have a suspected case, because by then it's really too late. And so, what we want to do is to continue our disinfection protocols. And again, this is not to the exclusion of other things. So, we don't want you to forget about installing appropriate HVAC or ventilation or filtration. We don't want people to forget about wearing their mask. But we think that we need to do all these layers of protection, as we have been saying for some time now. And now really isn't the time to start dropping a layer of protection. So, again, those layers of protection for individuals and for groups are vaccination for those who are at this point eligible 16 and up. And we know that in the coming months, we expect to have vaccinations approved for the younger age groups. But at this time, that is Pfizer for 16 and 17-year-olds. And for 18 and up, we have Johnson and Johnson and, of course, Pfizer, as well as the Moderna. We also want to be masking and spacing at least 6 feet distance. And the type of mask that you need will depend on what it is that you're doing. But certainly when you are indoors, especially for any lengthy period of time, then you will want to have higher filtration with your mask. And so that may include an N95 mask. If you have been exposed or if you have any symptoms, then we want you to get tested and quarantined. Now, if you've been vaccinated, then at this time, we are saying that you do not need to get tested after exposure. But anyone who gets symptoms, whether vaccinated or not, should be getting tested right away. If you believe you're exposed and you've not been vaccinated, isolate yourself, get tested in 5 to 8 days, and continue to isolate until you get your results. If you get COVID symptoms, get tested right away, even if you are fully vaccinated, and isolate until you get your results. And if you test positive, please do what you can to get your close contacts to also get tested and isolate themselves as well. What we are seeing across the country and here also in our county is that many fewer people are getting tested. And we do understand that cases have gone down, but of course, we want to make sure that people are continuing to avail themselves of testing, particularly if you're unvaccinated, but also in general if you have symptoms, because we know that we have more variants circulating. We need to understand how protected everyone is. And even though we believe that the vaccines are offering great protection, even against variants, it's still something we want to be on the lookout for, because there's so many things that we are still learning as we go. And this virus will continue to mutate and spread until we reach that herd immunity. So that is still the situation that we're in. But another very, very important reason to get tested if you come up with symptoms is that if you are positive and you are in a high risk category, you may be eligible for the monoclonal antibody cocktail treatments, which have shown to stop progression of COVID 19. And especially for those in the high risk categories, this actually can keep person from going to the hospital or from dying from COVID 19. And the only way that you can actually receive this treatment is if you get tested in a timely fashion and you get that treatment started within 10 days of symptoms. Our layers of protection for our indoor spaces, again, include ventilation, which is that circulation of air, whether that is through opening windows and doors or through your HVAC system. Also, your filtration, whether it's on that HVAC system or on a portable HEPA filter unit. And we're still recommending disinfection and sanitization of both our high touch and low touch surfaces. And of course, continue to wash your hands. That is a recommendation that has been consistent, not only since the beginning of COVID, but for basically any infectious agent. We want to wash our hands to prevent transmission for both for ourselves and also to others. And for everyone to optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.